A kinder, gentler approach to hip replacement surgery. 200,000 Americans every year, most with severe arthritis, have an operation to take out their hip and replace it with an artificial one. In the last 5 years, surgeons have increasingly been able to do this in a less invasive way. ABC's John McKenzie reports tonight on taking less invasive to another level. It is medicine on the cutting edge.
It's 6 a.m. and Rick Ritacco and his wife arrive at Chicago's Rush Presbyterian Medical Center. Ritacco, who's 49, is about surgery to replace his right hip.
It just got to the point where my physical activity was limited simply because my hip wouldn't move.
You can see here his normal left hip with the joint space between the two bones. That's where the cartilage is. Here's his right hip. You can see he's lost all of his joint space. That's his right hip that we're going to replace.
At 7:30,
let's go.
Ritacco is wheeled to the operating room, where he will be fully sedated. Unlike traditional hip replacement surgery, which can require a 6 to 8 inch cut down the thigh, this new experimental technique involves two much smaller incisions, about 1.5 inches, here and here. That allows the surgeon to work between muscles and tendons, as opposed to slicing through them.
We'll put some retractors around here so we can see quite nicely.
After surgeons break apart and remove Ritacco's arthritic hip, they prepare the new artificial joint that will replace it.
This is the ball and socket joint, which is now the new hip.
These are the same components you'd use in normal hip replacement surgery?
Absolutely the same.
Going through the same small incisions, doctors assemble the pieces inside the body. In less than 2 hours, the new hip is in place. 3 screws holding it together. But because there was less cutting on the body, patients have much less pain.
They take 1/5 of the pain medication.
And shorter recoveries.
The conventional hip replacement surgery, in most places, patients stay in the hospital about 3 to 5 days. With this particular surgery, more than 80% of our patients go home the same day.
Especially patients who are lean and fit.
How you feeling?
Within 20 minutes of arriving in the recovery room, Ritacco was already lifting his leg and moving his hip. A few hours later, he's with a physical therapist and starting to stand.
Under both arms.
I am shocked. This is much better than I could have ever expected.
By 4 o'clock that afternoon, less than 6 hours after the surgery, Ritacco is walking out the door. Doctors now want to see more cases like this followed for several years to see if there are any long-term complications. John McKenzie, ABC News, Chicago.
Just to review, this is experimental. Less invasive surgery is certainly the trend, but only a few doctors do this, and the medical community at large is waiting for results that are more, as John said, more comprehensive. When we come back